interesting that the name vampire facial has really caught up so much. It's actually platelet-rich plasma therapy, which we've been doing for many years now. But we all know that Kim Kardashian actually put it up somewhere on her social media and called it the vampire facial because it involves a lot of blood. So what is this? So we actually use your own blood. Okay, so from that we centrifuge the blood, we take out the platelet-rich plasma and we re-inject it into the face. Okay, we also inject it into the scalp or in wounds for wound healing, because the platelet-rich plasma is rich in a lot of growth factors. So it has the ability to get into the cells and stimulate new collagen production as well as help in wound repair. Because of all these growth factors, it's like food into the skin, and that's what the therapy is all about. So first of all, before the treatment, we do all your blood tests just to check if your liver, your complete hemogram, your kidney profile, all that is normal. Your vitamin levels are normal, your hemoglobin is normal. Once we see that, then we give you iron supplements and folic acid supplements for about a week. And then on the day of the treatment, you come in, we collect blood, we collect about 10 ml of blood, and we have a centrifuge machine. Okay, so that blood is put into a kit. There is a kit which helps, it's a reactor, so that helps in separating the red blood cells, the white blood cells and the platelets. So that entire thing is put into a centrifuge machine and the blood is centrifuged for about 5 to 10 minutes. Okay, so this separates, as I said, the lowermost will be the red blood, I'll show it to you. Then you have the white blood cells and then you have the platelet-rich plasma. So we collect that platelet-rich plasma. The whole process takes about 30 minutes. We collect that and then we will put it into tinier syringes, very thin needles, and then we inject it into the skin. Now, while this whole process of centrifugation is taking place, we apply the numbing cream on your face so that it's a painless procedure. Now, very recently, I would say in the last 2 years, we've also been using the Derma Pen microneedling device in addition to just injecting the PRP for an added benefit. So it really gives you much better results. And post the treatment, we'll apply a little bit of an antibacterial cream. Sometimes we just don't even do that because PRP itself is a wound healer, and then we apply a sunscreen and we go home. There is redness, there's a little bit of swelling, as you'll see, and that lasts for about maybe 12 hours to 24 hours. Some of my patients in fact love it. They say, oh, it looks like blush and we can actually go out for a party without actually doing any kind of makeup by evening. So, it's from person to person. So there's not much of a downtime except for that little redness and swelling for about 24 hours. So I think, as I said, because this has the ability to stimulate your fibroblasts, which are cells in the skin which help to produce collagen, there's new collagen formation. So it helps in tightening, the skin, improving the fine lines, reducing the size of the pores, and it also has the ability to reduce the pigment melanin. So it's very good for dark circles and, for an uneven skin tone, dull skin. So overall, it gives you that radiance, it has anti-aging benefits, and it is very good for scar tissue. So if you have acne scars, or if you have stretch marks, or if you have, say, chickenpox scars, or accident scars, or suture wounds, then you can combine this PRP with the microneedling or the microneedling radiofrequency or a fractional laser to improve all these kind of scars. So you have various benefits of this. If you talk of the glow and the radiance, it would probably last for about 2 weeks. But we are not looking at the glow and radiance. Okay, what we are looking at is the long-term benefit, is the improvement in fine lines, is the improvement in the size of the pores, the improvement in the skin tone, texture, all of that. So you have to do a couple of sessions. So you do a session every month for about, say, 4 to 6 sessions, and then it's not like a temporary benefit. It's a long-term benefit. So So if your scars have improved, they've improved for good. They're not going to come back to where they were. So I think anybody, right from normal skin to sensitive skin also, because it's your own blood, right? Of course, you should not have any active infections, and if you've had, COVID or something, we'd want to wait for about 6 weeks or 2 months. Otherwise, anybody is a good candidate.